Distinguished colleagues from Azerbaijan, Turkey, Kazakhstan, Uzbekistan, and Kyrgyzstan, I bring you warm greetings from Geneva, the cradle of global health. When we look at the state of preventive medicine in our region today, one thing becomes immediately clear. The science exists, the evidence is overwhelming, and yet the translation into daily clinical practice has failed at scale. Our new digital platform, NutriSteppe-AI, is our answer to that failure. It is an agentic AI platform that turns clinical nutrition science into 24/7 autonomous health companion for cardiovascular disease, oncology, metabolic dysfunction, and the patients who carry all three at once. The global data tells a story that should concern every clinician in this room. Just a week ago, on May 13, the Nature, which is a prestigious scientific journal, published findings from the NCD Risk Factor Collaboration, a project that led by Imperial College London. This is a paper I contributed to on behalf of Kazakhstan and several other countries where I coordinated the national health surveys. The results presented in this prestigious scientific journal show that obesity has plateaued in wealthy nations but is accelerating in developing ones. Our nations, Kazakhstan, Azerbaijan, Turkey, Uzbekistan, Kyrgyzstan, are on the steep part of the curve. 2.5 billion adults worldwide are overweight or obese. Dietary adherence without digital support sits below 30%. The burden of non-communicable disease in our region grows 4 times faster than in Western Europe. And 80% of cardiovascular and cancer cases are preventable through lifestyle. That last number is the reason our digital platform exists, because that prevention potential has never been unlocked at scale. And the reason is simple. The tools to do it did not exist until now. NutriSteppe-AI is a hybrid system. Deterministic mathematics combined with explainable agentic AI, resting on 3 pillars. The first is the one of the largest food database in the existence, 27,000 products and dishes, 135 nutrients per item, built specifically around Kazakh, Uzbek, Azerbaijani, Turkish, and Central Asian cuisine. Not adapted from a Western database, built from the ground up for the food cultures of this region. The second pillar is our algorithm engine. Harris Benedict calculates energy expenditure, and linear programming solves the optimal meal plan, maximizing nutritional quality while satisfying every clinical constraint simultaneously. Allergens, drug interactions, salt limits, fiber targets, fat thresholds, all in a single optimization. The third pillar is LLM orchestration. And here I want to be precise. The AI never computes nutrition directly. It interprets clinical intent, calls the correct mathematical method, and explains the results in plain language. Hallucination is structurally impossible. This system is clinically safe by design. What makes NutriSteppe-AI fundamentally different from any diet application or nutrition chatbot is that it is agentic. It does not wait to be asked. It acts continuously. It perceives patient data, intake forms, lab values including A1C, LDL, and ApoB medications, and dietary history. It reasons through every clinical constraint. It acts generating 7-day personalized menus, substituting dishes on request, building shopping lists, flagging supplement interaction. And it learns. Every feedback signal, every rejected dish, every new laboratory result feeds back into the next planning cycle. Your patient leaves your clinic on Friday, NutriSteppe-AI accompanies them through 48 hours of dietary decisions before they return. That is the clinical gap. No human team can fill at scale, and this system fills it. Every recommendation is built on two layers of food quality intelligence. Every dish carries a health food index, a composite score from zero point 0.5 to 5 that weighs fiber, protein, and micronutrients against fat, salt, sugar, and degree of industrial processing. On top of that sits traffic light gating. Saturated fat above 5 grams per 100 grams is flagged red. Total fat above 17.5 grams is flagged red. And products classified as ultra-processed by NOVA classification receives a scoring penalty regardless of what the nutrition label claims. A low-fat, ultra-processed product will never appear on a NutriSteppe-AI menu as a healthy choice. Linear programming then maximizes the aggregate health food index across all 27,000 items while hitting every caloric and clinical target simultaneously. Something no human dietitian can do manually, and the system does it in seconds. This slide is the one I want this audience to carry out of this room. 4 columns for patient populations, and every one of them is represented here today. For type 2 diabetes, personalized DASH menu calibrated to reduce HbA1c, amplifying GLP-1 agents like semaglutide through a mathematically precise dietary deficit. For cardiovascular disease and dyslipidemia, anti-atherosclerotic meal plans, high fiber, high omega-3, low saturated fat, working synergistically with PCSK9 inhibitors such as inclisiran to drive LDL-C and ApoB reduction beyond what the drug alone achieves. For obesity and metabolic syndrome, a calibrated caloric deficit, bioimpedance, body composition tracking, and protein preservation to prevent sarcopenic weight loss. For hypertension, metabolic dysfunction, associated steatotic liver disease, and cancer risk, DASH architecture, anti-inflammatory patterns, and polyphenols targeting the metabolic pathways shared by cardiovascular disease and carcinogenesis. All 4 conditions share one denominator, insulin resistance, and NutriSteppe-AI targets that shared pathway across every cluster simultaneously by design. For those who want to understand the mechanism precisely, and clinicians always do, here's the full pipeline in 6 steps. Patient intake capturing demographics, clinical goal, activity level, allergies, and dietary pattern preference. Harris-Benedict energy calculation. Constraint building. Every clinical answer becomes a hard mathematical rule. Linear programming optimization, finding the globally optimal meal plan. Healthy food index and NOVA scoring with traffic light filtering applied to every dish in the solution. And finally, the LLM layer, translating the mathematical output into patient-friendly language in Russian, Kazakh, or English. It could easily be adapted to any other language, including Azeri, Turkish, and Uzbek. 6 steps executed in second, clinically auditable at every stage. In practice, patients and clinicians interact with NutriSteppe-AI entirely through natural language. A patient asks for 7-day DASH menu at 2100 kilocalories with no shellfish and low sodium, done in seconds. They ask to replace their lunch with something lower in saturated fat. Done. A physician asks whether the patient can take magnesium with a beta blocker. The drug-nutrient interaction engine answers accurately. A patient with multiple intolerances, no gluten, no warfarin-interacting foods, no grapefruit, every constraint respected simultaneously. A weekly shopping basket optimized by both price and nutritional quality. A plov recipe for 4 portions with a health food index of at least 4. The cuisine patients grew up with returned to them in clinically appropriate form. Clinically great intelligence in natural language 24 hours a day. NutriSteppe-AI does not compete with pharmacotherapy, it amplifies it. With semaglutide, our protocol creates the dietary environment that amplifies GLP-1 satiety and prevents the sarcopenic weight loss that undermines long-term outcomes. With inclisiran or Cibrava, our protocol potentiates LDL-C and ApoB reduction beyond what the drug achieves alone. With survodutide as a companion to the synchronized cardiovascular outcomes trial, we provide the controlled caloric architecture and body composition monitoring that endpoints trial require but rarely include. The best clinical tool fails if patients disengage, and we know that dietary adherence without digital support is below 30%. NutriSteppe-AI closes that gap through 5 behavior change mechanisms. The living ecosystem, a digital avatar that thrives with healthy choices and dims when habits slip, making the physiologically invisible, metabolism, inflammation, energy balance emotionally visible. The body balance system, tracking energy, hydration, concentration, and stress as dynamic state, not a weight number. AI health insights surfacing patterns the patient has never consciously noticed. A late dinner correlating with poor sleep, protein breakfast with sustained afternoon energy. Custom avatar skins include the steppe sage, dressed in traditional Kazakh attire, playing the dombra, signaling to our patients that this platform was made for their world, not adapted for it. The discovery system replacing checklists with hidden collectibles, photograph a fish at the market, earn an achievement. Health at exploration, not obligation. Kazakhstan has 20 million people served by a primary care network reaching every region of the country. Our goal is NutriSteppe-AI as a national nutrition intelligence layer, personalized dietary guidance at population scale, with real-time laboratory feedback from ApoB, HbA1c, and HOMA-IR, feeding directly into each patient's planning cycle. From there, the natural expansion is the Turkic world, Uzbekistan, Kyrgyzstan, Azerbaijan, Turkey, a shared culinary heritage our database already covers, ready to be localized in weeks, not years. To the clinicians here, your patient face 24/7 of dietary decisions between every visit, and NutriSteppe-AI accompanies them through everyone. To pharmaceutical partners, protocols ready, platform validated, population underserved and understudied. To the Turkic world researchers, we share burden and opportunity this summit is uniquely positioned to act upon. I welcome your questions and your partnership. And with that, I'll close. 2 QR codes, 1 invitation. Scan the left to explore NutriSteppe, Food is Medicine. Scan the right to visit Sharman Pro, a website with information about thousands of diseases and conditions and medical news. Or write to me directly at Almaz Pro. I read every message personally. Many thanks to Professor Dadashova and the organizing committee for this remarkable summit. And thanks to every colleague in this room for your time and attention. I look forward to our conversation.